This video for Community Information Integration Central Patient Attachment Registry is about the key concept of keeping information confidential at the clinic. It's important to know that only information in mapped fields flows to the Community Encounter Digest in NetCare. Information recorded in other fields that are not mapped do not flow to Alberta NetCare. It's important for each provider to understand that if they must record information in a visit in a field that is mapped to flow to NetCare, that there are ways in their EMR to not share that information. See your specific CII CPAR EMR guide for those details. It's important to know what Albertans think about this, though. In 2017, in preparation for community information integration, a large group of Albertans were surveyed. Interestingly, over 70% of these Albertans think that care providers already have access to all or some of their healthcare information. They see computers in physician offices, they see computers in hospitals, and think that they are completely connected. So interestingly, Albertans already think that there's more sharing that's actually happening. When they were given a detailed description about community information integration, 90% of Albertans say they approve. There are very detailed information of the survey available on the ACT website. It's also important to understand that CII CPAR falls under the Alberta NetCare umbrella, which is covered by the Health Information Act. Participating providers are not required to have a direct conversation with their patients, but they are obligated to place a health collection notice poster in view of patients in the clinic. There's a customizable template available for download. It's also available in several languages. If a provider has a website or a patient registration page, they can also put the similar information there. The Health Quality Council of Alberta surveyed early physician participants in CII CPAR, and they found that Albertans did not have many questions when they saw the poster. They might ask what NetCare is. But should a patient ask questions, there is a patient brochure. There's also a script for the physician and team on how to discuss this with patients. There's an FAQ brochure. And finally, there's a privacy and security FAQ with more detailed information as well. Important understanding about how to keep information confidential is that only mapped fields flow to the Community Encounter Digest in NetCare. And it's always an option for physicians to document confidential information in the unmapped fields. These are largely note fields. As well, each EMR has confidentiality features. We know that Albertans already think that there's more sharing than it is actually happening. And in participating, display the health collection notice posters in the clinic or the equivalent on the clinic website. For more information, go to the CII CPAR webpage for practice facilitators.